Hi, and welcome back to Dogs Do Speak podcast with myself and Samantha Wayland. And today we got the lovely Kate Starkie, who's come along to talk about her role as a physio. So do please hit that submit button, press those likes, and you won't miss any future podcasts. So without further ado, hey, can you just tell us a little bit about yourself, please?
Yeah, so I'm a veterinary physiotherapist. So that means I've got a master's in veterinary physiotherapy from Harper Adams. So I qualified about 3 years ago. And then since then, I've been self-employed, mainly doing physiotherapy with dogs, but sometimes with horses and cats and other animals. So I've been doing that for the last 3 years. Um, and generally, I get referrals from dog trainers, vets, um, hydrotherapists as well. So we tend to work as a team.
That is really, really good. How does the role of physiotherapy help dog? How, how does that benefit dog?
Yeah, so usually what I do is I'll get a dog sent over because it's either had a surgery or an illness, or what's happening a little bit more now with my way of working is that the dog is having some behavioral problems that aren't necessarily making sense. So we're wondering if there's something going on there um pain wise that we need to rule out. And sometimes when a dog goes into the vet, they're already a bit nervous and a bit tense, and they'll hide a lot of um behaviors that might indicate pain on a subtle level. So the vets will say, well, there's nothing that I can find that's wrong with them. There's nothing that we can um identify, that we can measure in an x-ray or anything like that. Um, but we know that the dog is uncomfortable on some level. And a lot of what I do is home visits. So I go out and see the dog at home, see them move around, have a feel of the muscles and joints, um, see how they are using their body, what compensations they have, and then see if we can build a picture of how they're using the body and where they might be experiencing some difficulties.
So what we're saying is the client or the prospective client, from your point of view, gets that referral to you, yeah,
Yeah,
and then you may decide to go visit them in their home setting,
yeah,
and you do your whatever it is
assessment.
you do, your assessment.
Yeah.
It's strange that, isn't it? I would have said that if I was doing my own job because I know nothing about physio. I'm trying to find the right words. So once you've done your assessment, okay, you then book them in and they come along to see you.
Yeah. So I, like I say, I do the home visits, so I always go out to them, which dogs generally can be a lot more relaxed at home as well. Very rarely would they prefer, if they've got behavioural problems where they don't want you to come into the home. Most of the time they are a bit more relaxed in their own environment. Um, so then my treatment plan tends to be some massage to relax any tight muscles, infrared laser therapy that I use a lot of. So I've got a class 4 laser, and that's really good for providing pain relief into the tissues, increasing circulation, and a little bit of tissue regeneration as well. And that's tolerated really well because it just feels like someone's got a nice warm hot water bottle and put it on the skin. So they tend to tolerate that really well. And then we'll do an exercise prescription. So I'll come up with some targeted exercises that the owner can be doing, once or twice a day, but regularly, to build up any areas of weakness or anything we want to target with the dog. So that's a little plan that we'll come up with, and then I might see the dog 2 weeks later just to see how they're getting on, and how the treatment that we've done has helped them. And then if there's anything that we need to change, we can address it at that point.
So I may have misinterpreted it wrong in the beginning, but basically, you work in their homes. They're not
Yeah,
you don't book them in to come to a specific place like an office or a consultancy room. I get that.
yeah, yeah. So a lot of physiotherapists will have a centre that you can go to, but I don't do that. I just purely do it as a mobile um thing.
Which is really good because most people would prefer probably not to travel.
Yeah,
And if you're coming into their home setting, just makes it easy. And the dog or the animal is used to that home setting, so there's going to be not so much fear from that point of view. They're in a safe space. Yeah.
Mhm.
Have you ever come across dogs that are really that anxious, more difficult, more problematic to work with?
Yeah, so I do get some dogs from behavior referral vets that they say, oh, you're probably not going to be able to touch that one because they're that frightened. We don't want to. What I want to do is build a relationship with them. I don't want it doesn't matter enough for me to get my hands on them that we're going to put them through a stressful situation. And often, actually, by the time because we can do the laser therapy without touching them. So if we know that they've got really sore knees, for example, we can laser the knees without touching them. They can have a bit of food reward, or if that's going to help them. But there are plenty of dogs that I've worked with that I can't touch. I can advise the owner how to do the exercises. Um, we can do the laser therapy. I can help by the owner sending me videos of them doing the exercises when I'm not there because sometimes for some dogs that's even too stressful. They won't take food while I'm there. So there's always things that we can do to work around it. And the important thing is that we're not putting unnecessary stress on the animal for the sake of going through the motions and doing it the way that we would normally do it.
Good pleased to hear that. Yeah, that you are respecting. Yeah, the animal's space, their emotions, how they're feeling,
Mhm.
and you're what's the word? Giving them an opportunity or choice if they want to come closer,
Yeah,
and, and interact whilst you do your work. Because I don't think enough of us in the industry um, do that. We don't give animals the opportunity to have their choices.
yeah.
We rush in, we want to be hands on to them. So let's just go back a little bit. What actually brought you into the role of becoming a physio?
So my undergrad degree was actually equine science, behaviour and welfare, and then I went on to work for quite a few years with rescue horses. So we were rehabilitating them and trying to get them ridden if possible, because that would increase the chance of them being rehomed. But basically, trying to get them to a stage where they're happy to be handled, they're confident around people, and therefore they've got a good prospect of being rehomed successfully. And that was good because obviously when you're working with a 500 kilo animal, you can't force them to do anything. And if they're frightened, it becomes dangerous. So, they will knock you over to get out of the way. They're flight animals. So at the end of the day, their behavioral response is fight or flight. And the first one they'll choose is flight. So from that point of view, you learn to that when you give them a choice, they are a lot calmer. If they feel like they could move away if they wanted to, then it creates a much calmer situation for them because then they can use the part of the brain that is making good decisions, not the part of the brain that's trying to help them survive and usually making bad decisions.
I've got to say, you're a lot braver than I am because when I was in the police service, I often worked with horses, not in the sense I rode a horse. I wasn't a person on horses, but certain events we would be at, they would be there, and at football matches, you'd have the horses behind you, yeah,
Yeah.
and all they'd be doing is pulling on your epaulets, yeah. And I've got to be honest, I was crapping myself many, many, many times, yeah, because they're very powerful animals, yeah. Once they get hold of an epaulet, you are going where that horse propels that, yeah. And eventually they would let go.
Yeah, I think
And
for me, falabellas are about my limit for a horse. I'm like, you're about dog size. That's good for me.
The little ones are the ones you've got to watch.
It's the same with dogs.
you're a brave person. So you did your degree,
Yeah.
your masters, and how did you find your role? How did you quickly get into it?
Yeah, so it was actually somebody else that I'd done my undergrad with. I was getting to the point where I had some back problems from, getting squashed by horses and one thing and another, getting a bit older. And then yeah, somebody that I'd done my undergrad with had put on they just qualified as a veterinary physiotherapist on Facebook. So I messaged them straight away and I was like, oh my God, how have you managed to do that? So she said, oh, it's a postgraduate course you can do. So it was a postgraduate diploma in veterinary physiotherapy. And providing you've got animal science undergrad that's appropriate, you can get onto the course. So it was 2 years part time, working full time and studying, which was quite difficult, and then topped up to the masters by doing a research project after all that had been finished. So I actually only fully topped up to the masters officially September last year. So I got my cap and gown finally, graduated.
Well done.
It's brilliant.
And then you went into the what I call the real world,
Yeah,
of actually hands-on work, working with clients with their
yeah,
pets, dogs,
yeah, and
horses.
building up a client base.
So let's just say the client has got her dog or his dog at home, and they have come from a rescue, yeah,
Hmm.
and the they are working alongside a behaviourist or a trainer who says that this particular dog is always stressed, doesn't know how to relax,
Yeah,
doesn't settle at all, has gone off their food, and I personally would be looking at let's go do some bloods, let's get this dog physically checked out at the vets to see if
yeah.
there is an underlying reason. Vet then contacts you if they believe physio is needed. How do we distinguish where physio is needed? That's the bit I can't get my head around.
Yeah. So actually a lot of vets, in my personal experience, don't think of physio as it doesn't really come into the head as much as I would think it would do. So a lot of referrals are self-referrals from the owners. So the owner's gone to the vet and said, I'd like a referral for physiotherapy. And then it's up to the vets to provide whatever information they feel is relevant on that referral. Sometimes they'll just put owner feels animals uncomfortable. Sometimes they'll put a bit more detail on saying, oh, if you feel that there's an issue, can you come back and let us know and we'll do x-rays, for example. But a lot of the time, for me, it's the owners that are requesting that referral from the vets and not the other way around. Um, and I think that's because even though animal physiotherapy has been around for quite a long time, it's still not generally thought of. It's not the first thing that you would think of. And people don't even know how it's relevant to their animals. So they'll say, oh, my dog's limping, but he is quite old. So I don't think he's in pain. He's just limping. Whereas from my point of view, I think, well, we don't limp for no reason. If you were limping, would you be in pain? So it's changing the mindset and that kind of thing. And ultimately, what I can do is do an assessment that looks at how the animal's using its body. So a lot of animals, a lot of dogs naturally have 60% of weight on the front legs and 40% on the back legs. Where you've got a little bit of hip dysplasia or knee problems, that'll then increase a lot. So the dog is then cranially loading. That creates back pain, shoulder pain, muscle loss on the back legs. And these are all things that I can pick up that aren't necessarily clinically relevant by themselves, but as a general picture of the animal, show us that something's going on. And it can all depend on the animal's pain threshold, how they respond to pain. If they've got a younger dog in the house that's jumping on them and they've got a sore back, they're going to be more reactive, that kind of thing. So it's a very individual dog to dog basis, but ultimately we want to see if there's a reason why they aren't coping in the way that we would normally expect.
What about preventative physio? So obviously certain breeds are sort of more prone to different issues. Is there sort of preventative things that you can offer clients?
Yeah, absolutely. So I work with quite a lot of agility dogs, some sports dogs, and the important thing is that we once you've lost muscle, it's really hard to get it back. Um, so things that we want to make sure is that dogs are not getting into that position where they are cranially overloading too much and have lost that muscle. We want to try and get in there before that happens, because by the time the dog's limping, it's got to a really bad stage. A lot of dogs will try and hide discomfort. But generally, things that are really going to help is my main one is not using a ball chucker, which is a really common way people want to exercise their animals and get energy off them. But actually, when you are doing that really fast acceleration, twist, deceleration, that's a really fast way to get your dog an injury. That'll either be spinal, or the most common one at the minute is cruciate ligament injuries in the knee. So that torsion through the knee over and over again as you're playing that fetch game at high speed, is wearing away at that cruciate ligament. And ultimately that would result in a surgery. And usually the other leg will go within 6 months. So that's a double surgery. So unless your dog is really well insured, or you've got, £3,000 each time to be throwing at that situation, it's really good to do other things with your dog instead of playing fetch to tire them out with a ball launcher. So that's one that I would definitely avoid, is repetitive fetch, or things involving a lot of deceleration and torsion through the legs. The other one is, that also causes similar injuries, is slippy laminate floors. So that's obviously when you've got a dog, you're thinking it can be mopped clean, really easy to keep on top of. But actually, if your dog can't sit on the floor without its feet splaying out, or it can't run into the room without going skidding on its bum, ultimately you are creating pain and discomfort, because every time that dog slips, you're creating muscle tightness, as well as these joint breakdowns as well. And then obviously the last one is keeping on top of the weight. So an overweight dog is going to wear the joints out more quickly. They're going to be uncomfortable. So yeah, they're my three things to prevent joint breakdown in dogs as they age.
Is there anything that you think that sort of owners or dog trainers could sort of keep an eye on or spot before there's sort of a major, muscle loss and things? Is there anything that people can spot early doors and then come to you before there's a major problem?
Yeah, so one thing that gets missed a lot is it's actually quite difficult to see lameness in back legs because the dog isn't lifting its head as it limps. But actually, what you will see in dogs is that they are not lifting the back feet up very high. So sometimes you'll hear them scuffing the toes on the floor as they're walking. Sometimes it's even that they'll trot everywhere because it's actually really hard work for them to walk and use the back legs individually. Whereas when they trot, they're using the legs in pairs, and the front legs are doing all the work and the back legs are just following on. So a dog that prefers to trot rather than walk slowly, and when you try to make them walk slowly, they are looking uncomfortable, or trying to trot again. That's definitely something that you'd want to watch out for. Another thing is tightness through the back, because people think the dog has a sore back, but usually in quite a lot of cases that I see, that's secondary to discomfort in the hips or the knees. So if you are stroking your dog's back and then you notice that they're looking around at you or licking, or that you feel spasm on the dog's back, so when you're stroking them, if it's like the skin is moving under your fingers, that can be a really early indicator that the dog is compensating in some way because they've got discomfort somewhere in the body.
That's really interesting, especially with the trotting. I'd never even really thought of that, but now that you're saying it, it's making sense. Yeah, I like that. That's really interesting. I like that.
Yeah, because a lot of people, when they take the dog for a walk, they're on a mission. So they're walking, the dog is trotting next to them, the dog's doing a nice little happy trot, and you think, oh, this is great, dog's having a nice time. But actually, they can be losing muscle mass because they're not using the back legs properly. So it's important what I would always advise people to do is the first 5 minutes, make sure the dog's walking, warm up the muscles, go and do whatever you do normally on your walk. And then the last 5 minutes, get them doing that slow walking again to make sure that they are comfortable, the muscles getting warmed up and cooled down.
What about sleeping arrangements and furniture and where dogs actually get to rest? Do you find that can also be a problem for their well-being, physical well-being?
I mean, the main one is little dogs, because when they are jumping on and off furniture, and that would be a combination of jumping off onto laminate floor and slipping, or even just the impact of jumping off, because obviously for little dogs, the couch can be quite high. Somebody knocks at the door, the dog goes flying off barking, and that can cause problems where you've got disc extrusions, where there's a constant degradation of the tissues in the spine, where you're getting that impaction going on, and then eventually the material in that disc will extrude or move, and then that can cause spinal compression, and that's where you get things like IVDD, where you potentially got a sort of paraplegic situation going on. And that's something that's prevalent in, or potentially genetically prevalent in, sort of 24% of Dachshunds, but also French Bulldogs. So these are the kind of dogs where we definitely don't want them jumping on and off couches. You'll see a lot of people using the little sets of steps so that dogs can get on and off without jumping. But ultimately, like I say, when somebody knocks at the door, a lot of dogs are going to react straight away, jump off the couch and go flying over. So it is a difficult one to manage, but it's a very important one to try and manage, because the consequences of not managing it can be catastrophic. Ultimately, you could end up with a dog that's not able to express its own bowels or its own bladder, and might need to be in some kind of wheelchair to move about. So we definitely want to avoid that as far as possible.
Yeah, I've got a Dachshund, and we actually had to get rid of our steps because he used them to climb up onto the sofa and then jump off. So he thought it was a game. So we had to take them away to get rid of the constant game of, I'm going to watch me jump off everything. And so when you're talking about dogs like that, would you say things like extra exercise, things to build up the muscle, does that help, or is it?
Yeah, so a lot of things that we end up doing to try and build up the back legs is things like the slow walking, because they're using the back legs individually to the front legs. But also things like if you ask a dog to do a sit to stand, that's with the back leg staying very still, so that's not jumping into it or doing a kickback sit. That's kind of like us doing a squat. So you're engaging the glutes, you're engaging the quadriceps muscles, and they're quite important for stabilizing the back legs, stabilizing the hips, taking a bit of strain off the spine by engaging the core. And you do sort of 5 in a row. You could do that a couple of times a day. If you put the kettle on, get your dog to do 5 sit to stands. But we are looking for, with that exercise, we're looking for quality over quantity. We don't want them jumping up and down. It's got to be slow and controlled, as if we, as a human, was doing a squat, engaging those muscles. And some dogs find it really difficult. It's surprising. You think all they need to do is sit down and stand up again. And a lot of dogs can't do it without moving the feet, because they're pulling themselves up with the front legs and not pushing with the back legs. And then the other one that we do really commonly is to use a little pad or step or something that's non-slip. A lot of people make their own platforms with a bit of wood and cardboard or carpet as well, so that it's not slippy. And all we want to do is have the dogs have the front legs up on that, so that we're pushing the weight onto the back legs a bit more. And in that position, we can do side stretches, paw lifts, forward stretches, and they're really basic low impact ones. So a dog that already has joint problems can be taught to do these stretches in a way that's going to help to engage the core and build up the back leg muscles, but without risking an increase in injury. So there's loads of things we can do from a physio point of view to maintain a dog's back legs and keep them strong.
I don't want to do you out of the job, because you sound awesome. Yeah. A lot of what you're discussing and just mentioned, a lot of these things, if we educate owners, yeah, in how to, what's the word, socialize their dogs within their home space, where they live, they don't need a physio.
Yeah, unless they had a specific condition that needed managing. Yeah, and I do feel as well with these exercises, sometimes you only notice that the dog's got a problem when you try to do these exercises and then find that they can't for some reason. They're not able to perform it in the way you would normally expect. So things like a lie down to stand, or like a fold like you would see in rally, should be quite a straightforward exercise for a strong, healthy dog to do. But the amount of dogs that will either sit up and then stand up, or they'll drag themselves forward with the front legs, so you see the shoulders come up and then the bum.
Yeah.
It's in that situation where you think, oh, they're not as strong in the hind legs as we expected them to be for a very active, healthy dog. So it's quite common that we would see that. But yeah, I'd be more than happy for people to be doing conditioning with their dogs throughout their life, because a lot of what I see potentially could have been either mediated or delayed by doing things with the dog earlier.
Yeah, and also with education, when we're educating clients, um, simply wooden flooring, yeah,
Yeah,
jumping off sofas. Maybe if people were more educated and not allowing these dogs onto sofas, so that when there is a change in the environment, the doorbell rings and they're shooting off, maybe we should start looking at how we can stop and prevent these behaviours from occurring in the first place.
mm,
I did, do you know what? I did not realise there was so much more to it
yeah,
from a physio's point of view, which are the same problems myself and Samantha, and many dog trainers that are, going to be watching this podcast are going to say, Roger, we talk about this every day, we tell our clients every day, they don't listen, and then they have to get someone like you. Yeah.
yeah,
Um,
exactly.
which is not sad, but sad from the dog's point of view, because we could have prevented certain things. But you're there to help.
Mm-hmm.
Medication. Do you deal with medication?
Not personally. It's something that the main way that I'm involved in it is where a dog's been referred, they might be on medication, for example, fluoxetine, anti-anxiety medication, pain medication, and the vet or the vet behaviorist want to know, once we've got this dog to a certain level of comfort, by strengthening them, can you facilitate us reducing those off? And then you monitor the dog and see if they are still coping. So that's the main way that I deal with medications, is to assess how the dog is responding to them, from a sort of pain and the way they're physically managing point of view. But it's not, I could definitely be a lot better at understanding medication, but it would take me a lot of time to um, learn about how different analgesics work together.
I really like that because it's like that really holistic way of doing it, isn't it? So you've got the trainer doing their part, and you've got the vet doing their part, and then you've got the physio coming, and you're all coming at it from your own angles to covering everything. And I think, yeah, I really like that.
Yeah.
Yeah. Especially, I was thinking the same thing, Samantha, when I was talking about stand. Yeah. And the trainer can teach a good stand. Yeah. To help. And then the physio goes in and gets that precision that's already there. And then you get a better assessment. And
Mm.
then you've got the other parties doing their bit. Absolute collaboration. I love
Mm.
it. Absolutely love it. Yeah. I've learned a lot just in this discussion that I would never have thought, um, that I've noticed. And I've noticed a lot of things you've just mentioned without really thinking about it.
Yeah. Especially with the back paws and not quite lifting them up properly and scuffing them
Yeah.
along the floor. And now I'm thinking one of my dogs is a rescue dog who had she had a broken leg when she came to us from Romania, and she does that a lot, especially if she's tired. You can hear her
Yeah.
scuffing her back paws because one of her legs isn't as strong as the other one. But I don't think although I'd noticed it, I don't think I'd realised quite what that meant. And now everything's sort of slipping into place. I'm like, oh, okay, I see.
Yeah.
Get
So
back
one
on
of
it.
the when we've got things like, what is more common than we would think is conditions like hip dysplasia.
Mm.
So for example, when you've got your big retriever breeds, it's quite prevalent on a low level, and obviously breeders want to um do x-rays to check this out and make sure they're not obviously perpetuating it within the breed. But ultimately, a lot of dogs have a low level of hip dysplasia, where it's that low sort of level that you could do x-rays, but it wouldn't change the treatment because the vet would say it's not significant enough for surgery. But yeah, it's definitely enough that it will cause a little bit of discomfort, because when the dog moves, there is a little bit of extra movement there. As the dog gets older, that's potentially going to turn into a bit of arthritis, and then cause a bit of inflammation and discomfort as they get older. But in situations like that, from a physio point of view, we can build up the muscles that are supporting the hip, then we can reduce that movement, we can reduce discomfort. That allows the dog to be more active, which builds muscle. And then you get on sort of a positive cycle with that, where we are maintaining the joint in a healthy way because we are maintaining muscle mass. And then we do see it the other way as well, where a dog will maybe pull the groin or something like that, slipping on the floor or on ice or just playing. Then they'll lose a bit of muscle mass because they've been a bit uncomfortable, and then the joint starts to move more, so they're uncomfortable, so they use it less, lose muscle mass, and then you get in this cycle where the dog potentially on analgesics because of the discomfort in the back leg. So for me, if you can build up muscle mass, you can create a lot less discomfort by supporting the joints just by maintaining muscle mass and function.
Yeah, so obviously earlier as well, you spoke about the red light
Yes.
therapy. So obviously I'm of an age where red light therapy is very much a mask on your face to make yourself look so much younger. I'm assuming that's not what it is for the dog. So is that something that you would then do if they're in pain and you're working alongside, things like that?
Yeah, so I use my laser on almost every single patient that I treat because it can do so much in one go. So I'm a really big advocate for it. It is kind of similar. So red light is at that spectrum of light, so we can't see red light. So when you have it on your face, that's kind of an LED light emitting diode form. So it will do something, but it only penetrates a certain amount of cells. The kind of red light that I'm using is a laser, so that will penetrate deeper because the wavelengths work slightly differently, so they'll penetrate deeper into the tissues. So it's kind of thought that a class 4 laser will probably go about 5 centimeters deep into the tissues, and then because the way it works is to stimulate the cells to produce chemicals for opening up blood vessels, which will then decrease inflammation, providing a bit of pain relief. So it's the body's own pain relieving system, and also tissue regeneration. That will permeate through the tissues as well. So potentially it will go a bit deeper, and it'll work. It works for about 12 hours as well. So it's almost like having a hot water bottle on the skin, but going quite deep for 12 hours. So I really like it because in terms of side effects as well, it doesn't really interact with any medications. There's very few contraindications to using it. So we wouldn't use it on any weird lumps that we thought might be cancerous because it encourages cell growth. But apart from that, it's tolerated really well and it can do an awful lot of good. So I use it on myself when my back gets tight. I use it on my own dog who's got a problem where she's got a little bit of patella movement. So her kneecaps sometimes, if she slips in the mud or something, can just pop out a little bit. So I use it on her to reduce inflammation. Really good for arthritic dogs because you provide an additional pain relief that's not going to interact with the medication that they're already on. I'll use it post-surgery because it's really good for healing wounds. It's really good for reducing edema and inflammation. So it can do so many different things. But like I say, the best thing about it is that almost the worst thing it can do is nothing.
Yeah.
So if in doubt, we usually just go for it.
And that 5 centimeters, that's fascinating. I didn't even realize, obviously I've heard of red light therapy, but I didn't realize how deeply it penetrated into the tissue. That's amazing.
Post-op. Do you ever get to work with dogs post-op?
Yeah, for me, the referrals always come a little bit later than I would like. So the vets prefer to refer sort of 4 to 6 weeks post-operatively, but for me, in a situation where you've had surgery on a cruciate ligament, so that is within the knee, I'd really like to get in there and laser the wound to help that heal more quickly, laser the stifle area to reduce inflammation and swelling. But I'd also like to do things like passive range of motion exercises. So quite often in those situations, the last thing you want is for that knee to seize up. And sometimes when they're painful, they don't want to move that joint. So ideally, what you would be doing as a standard post-surgery protocol is to have the owner really gently opening and closing that joint to keep that joint fluid moving within it, to keep those muscles moving, because ultimately you don't want to get in a situation where the dog isn't wanting to put the foot down because everything's tightened up and seized up. And then there are really gentle weight bearing exercises we can do. So, for example, where the dog is stood, we can really gently push them over onto that leg and back again. So I think the vets sometimes think that we might be putting them on a wobble cushion and doing really dynamic stuff with them straight away. But ultimately, there's a lot of things that I would want to do really early on so that we are reducing the likelihood of complications. Because I don't want to get a dog 6 weeks post-op that is really stiff and uncomfortable, because then it's taking a lot longer to get that full recovery.
Yeah, so it's about educating sort of the vets from that side as well, isn't it? As well
Yeah.
as us, and not just because I suppose they're in their heads they're thinking, oh, physio, she's going to be, bending them and
Yeah,
putting them in
it's
all these
almost like a
positions.
bit of a please don't mess with my
Yeah,
surgery and ruin what I've done. I completely understand that, because if anything goes wrong, it's going to come back to them. What have they done wrong in that situation? So I completely understand that, but it would be nice to have a little bit more trust, that we can help and we can actually improve the outcomes in a lot of cases by getting them weight bearing earlier.
I totally agree with you. It's industries all over where we need to be talking to each other more regularly and understanding what each other agency has to offer. So
Yeah.
that the quicker we get the physio in, yeah, the better. Yeah. I understand it from the vet's point of view too. Because when I think about pain, I just think about I don't want to come too close. I don't want to tap. I don't want anyone, go home and rest up. So I do get it, but at the end of the day, I think we need to really get together and really thrash this out. You do what you do, and if you get me to come in earlier, then we can get the physio in earlier, or whatever, however it's
Yeah.
going to work. So that dogs, animals, horses, cats, what's the word? Are getting their needs met and their physical um, needs met. I'm sort of sidetracked there because something came into my head. Cats. You work with cats.
Yeah. So cats are a difficult one, but a lot of physios will try and work with cats and some hydrotherapists as well. But obviously, it really depends on the individual cat as to how well they're going to tolerate that. So there's two cats that I work with regularly currently. One is a ragdoll cat who's really placid, and he has a little bit of hip dysplasia, and he also has an abnormality on his spine. So when he was younger, his owners contacted me because he was on a lot of medication, but ultimately he was just curled up in his bed the whole time and didn't want to move. So he had no muscle mass, which obviously was exacerbating the hip dysplasia, and he was really, really painful. So we tried to get him to do a little bit of exercises, but ultimately, because he was so uncomfortable, he didn't really want to move. He wasn't really motivated by food. Um, so we did weekly infrared laser therapy with him. And after the first session, he started climbing on the bed. And then after a few sessions, he started playing with the other cats. And now we just do a maintenance where I see him every sort of 4 to 6 weeks to give him a top up of the laser therapy. But ultimately, because he's now moving of his own volition, he's built up muscle mass, he's got more support in his joints, and like I said, we've got this positive cycle of where he's more comfortable. He's still not really interested in doing anything for treats, so it's hard to get him to do any specific exercises. But at least we could do something to help him, because they were really at the point of making a decision whether it was kind of to put him to sleep. So it was really lucky that worked for him. And then the other cat that I work with, unfortunately got hit by a car and had to have one hind limb amputated, and the other one had had surgeries on the knee, and the lower limb as well. And she was really uncomfortable. She doesn't tolerate massage. She will not take treats off me because she's just too worried, or I guess not food motivated as well, which is quite common with some cats. So we do just laser her as well, because she's only got one back leg. She gets sore in the back, so the laser's good from a maintenance point of view for her as well, because she'll tolerate that, because she doesn't feel like we're touching her, because we're using the non-contact head on there. So she quite likes it because it feels nice and warm. And then ultimately, after we've done it, she'll have a really nice stretch and then have a couple of weeks where she's a lot more mobile and active. So I treat her every 3 weeks because as it comes to the end of the 2 weeks, we notice her starting to slow down and looking a bit more uncomfortable again. So again, sometimes we are kind of limited what we can do with cats, but the red light therapy works really well with them. There's some hydros that work with cats that'll be able to get them in a water treadmill. Um, but but yeah, it really depends on the cat. My cat is really food motivated, so I keep meaning to get some videos of him doing some stuff on like wobble cushions because I can a lot of what I do, obviously I'm not a dog trainer, so I lure everything. All my exercises that we're luring the dog to do things, we're teaching them behaviors literally by rewarding them when they've got the paws up or so I can do that with the cats because although some cats are quite trainable, as long as they're food motivated, we can roughly get them to do what we want to do. So that's next on my sort of plan is to do some little videos of cats doing physio. But yeah, it's very individual on the cat as to how much you can do with them physiotherapy wise and how much they are prepared to tolerate from the human as well.
So glad that I sidetracked. I was asking a specific question, and for some reason I mentioned cat, and I can see that beautiful cat in the background. Yeah,
Yeah.
and I'm so glad I did that because now we've learned that physios can work with cats. Yeah,
Oh
well,
yeah,
I have.
absolutely.
Kate, it has been an absolute pleasure. Yeah, I've got a lot of takeaways from this, and
Yeah.
I'm sure when people are watching this, they're going to learn a lot why physios are very important to animals, not just dogs. We discussed horses, we discussed cats, and I'm pretty sure there are going to be other types of animals too that physios can work with. And the understanding that the vet organised, the vet system, the dog training world, physios, we need to collaborate more, yeah, and
Mm.
get more of an understanding of what each other do and how we're beneficial to the animals, yeah,
Yeah.
in Raina's case, his dog. So, Kate, it's been an absolute pleasure, and thank you for coming along. Um, Everyone that's watching this, please hit that submit button. Please press that like so you don't miss any future podcasts for myself and Samantha. We've got loads of good hosts coming up and guests coming up. So until the next time, it's goodbye from